Now, toddlers also have the intuitive dash projective stage of faith, so you have to instruct parents to provide simple answers to questions about religion, God, church, and you have to instruct them on the importance of incorporating religious rituals and ceremonies into daily life. Now, on the nursing side, wellness includes regular exams and immunizations that are essential. When you teach children at this toddler phase, toddler stage, you have to be at the child's eye level, and you have to use kid language. Respiratory infections and parasitic infections are of concern, so you teach hand washing and again encouraging immunizations. Growth begins to slow during this stage, so nutritional needs change. Protein need and fluids decrease, and toddlers need fewer calories, and they often become much pickier than they were. They should not be allowed more than a quart of milk a day because it causes anemia because they fill up on the liquids and they don't eat other foods. Parents should be taught to avoid using food as a reward. They should not serve large portions, and they should expect sporadic eating patterns. They should avoid power struggles, establish mealtime routines, and provide nutritional snacks. For healthcare, when you're dealing with a child in this toddler stage, you have to remember to talk in a calm voice, promote play for teaching and relieving anxiety, provide simple, short directions, comfort the child, and encourage parent participation. Safety in the toddler stage, accidents are a frequent cause of disability and death. Again, promoting car seat usage. And because of the increased mobility and curiosity of the child in this stage, they're prone to poisoning. So you make sure that the home is child-proofed. You have to make sure that the toys are age appropriate, with no sharp edges or corners, no small parts that can be swallowed. They should monitor for poisonous paints, and they should not have any flammable or toxic materials close at hand. The next stage is the preschool stage, which is 3 to 6 years. During this stage, growth slows, psychosocial and cognitive development accelerate, curiosity increases, and there's increased communication. Parents should understand that why is normal for psychosocial and cognitive development. Kids are going to ask why about everything. Again, you use play to facilitate rapport and relieve anxiety. On page 10-7, 212, table 10-7, again, the characteristics. Physical growth slows. The average weight of age 5 years is about 45 pounds. They have the head size that's approximately that of an adult, and the deciduous teeth come in fully. These baby teeth start to fall out at about age 6 and will be replaced by the permanent teeth. So you have to have the parents encourage them to eat a variety of foods and larger meals. Fine motor skills develop. They can usually skip, throw a ball overhand, use scissors, and tie their shoelaces. You emphasize providing a safe environment for play and exploration. And they should be appraised for attempts at independent activities. This is the phallic stage. The Oedipal conflict leads to the development of superego, and this is the initiative versus the guilt stage. Self-control is learned by interacting with other kids, or with others, adults and children. This is also the pre-operational stage. So you have parents tell the children that this is the age to learn through the frequent use of the word why. We talked about that. They have a vocabulary of over 2,000 words. Play is more reality-based at this stage. They have the increased ability to communicate. They increase socialization with peers. It's the pre-conventional stage, and encourage parents to teach the children basic values, ideally by modeling. A conscience begins to develop, and they fear wrongdoing and seek parental approval. You encourage the parents to provide consistent praise and acceptance. This is also the intuitive projective stage of faith. They're not yet able to understand spiritual concepts, but they imitate the parents' behaviors. Teaching by example is the best approach for the child at this age. Wellness for the preschool stage is communicate on the child's level. Don't talk down to them. Allow the child to make some decisions and participate in some activities. Make health education fun for them. Teach them the alphabet song when they wash their hands. Teach them happy birthday when they brush their teeth. And again, promote immunizations. Safety at this stage is about accidents, and they're the leading cause of death. They don't understand consequences, and they have the curiosity to explore. Parents must use the word no, and they must understand the importance of using that word. Common accidents result from MVAs, falls, burns, animal bites, drowning, and poisonous ingestion. The next stage is the school age, which is 6 to 10 years. Physical changes are now slow, even, and continuous. The world greatly expands for the kids in this stage, and their school activities, their sports, and they have an increased social circle. Play is less spontaneous, more structured. They have increased communication, and they have a much more expanded vocabulary. On page 213, table 10-8 is appropriate for the school age child. They have that steady physical growth of approximately 3 to 6 pounds and 2 to 3 inches per year. Emphasize to parents the need for the balanced diet to sustain growth requirements. The body has an overall slimmer shape, and the CNS maturation is nearly complete. By age 12, all the permanent teeth, except the second and third molars, are present. They need daily dental hygiene of brushing and flossing, and they have regularly scheduled visits to the dentist. They should have their toothbrush changed about every 3 months. Motor control continues to develop, so you encourage participation in physical activities. They're less dependent on their parents for activities of daily living, and they should be praised for that. This is the latency stage. Same gender companions are preferred. And for children to develop a sense of confidence, you encourage the child to participate in group and individual activities. It's also the industry versus inferiority stage. They develop initiative and high self-esteem as manifested in school and sports. And the parents, again, are encouraged to praise the child's efforts. The child's less dependent on the family at this time. It's the concrete operations stage. They have the ability to cooperate with others, and to see other points of view leads to more meaningful communication. Again, encouraging group activities. The reasoning is now logical and rational. Abstract thinking is not fully developed. Remember the child's level of comprehension. The concept of time develops. They know the difference between past and present, and they will begin to learn to tell time. They have the ability to categorize, classify, and order objects, and relationships between objects can be seen for them. Also, this is the conventional stage. Parents should provide consistent limits. They understand what's acceptable behavior, but may need assistance to choose the difference between right and wrong. Again, emphasizing modeling as appropriate behavior and appraise appropriate behavior. This is the mythical literal stage. Encourage parents to discuss their beliefs. They accept that a deity exists, and then you have stories to reinforce understanding of spiritual concepts, and beliefs are symbolized through those stories. For this stage, the school age stage, wellness, upper respiratory infections are common, as well as accidents, and school nurses can help promote wellness. For safety issues, they have accidents due to trampolines, skates, skateboards, bikes, and scooters. So you promote helmet usage, remind them not to play near traffic, and you teach them about strangers. Pre-adolescent is the next stage, and that's a 10 to 12-year-old. There are rapid physiological changes, hormonal changes that occur with the onset of puberty. Girls reach puberty much earlier at about 9 to 10 years. Boys have puberty at about 10 to 11 years. This is the time when girls' breasts develop and menarche begins. For boys, testicular enlargement, penis enlargement, The scrotum becomes redder and thins, and pubic hair grows. Nurses need to be non-judgmental and be aware of body language, and remember that many pre-adolescents have misinformation. Now, for the pre-adolescent, this is page 215, table 10-9, and they have those physiological changes. Physical growth accelerates and is accompanied by changes in the body proportion. The extremities grow fast, then the trunk and the hips. Excuse me. You need to teach the child and the parents what to expect in growth spurts. And then they have endocrine changes. The hypothalamus stimulates pituitary to secrete gonadotropins, which causes reproductive maturity. Primary and secondary sex characteristics develop. So you need to provide information and support about sexual changes. Again, we talked about girls, the breast development, pubic and axillary hair grows, onset of menarche, height increases. For boys, puberty, the genitals develop, facial, pubic, and axillary hair grows, ejaculations occur at night, height increases, and voice deepens. The bones start to ossify, the muscle mass and strength increases. They should be encouraged to participate in physical activities and should have an adequate intake of calcium. The last four molars erupt, and they should continue that daily dental hygiene. The skin becomes thicker and tougher. The activation of sebaceous glands may lead to acne, and pubic hair appears. They should be encouraged to use sunscreen and avoid prolonged light exposure. Sunlight exposure, excuse me, not light. They don't want to sit in the dark all the time. You should support pre-adolescent that is experiencing acne. Okay, I've talked too much tonight, huh? Okay, they have completely independent in performing self-care activities. So again, encouraging the parents to allow some freedom of choice and expression. This is the genital stage and the identity versus role diffusion stage. The major task here is to develop a sense of identity. They have a new body image that develops. They have intimacy with members of the opposite gender. Sex education is important at this time. Their primary support is their peer group, and they often rebel against adult authority. You have to educate parents that rebellion is part of the normal developmental experience, unfortunately. This is the formal operations stage. So sometimes they have a false sense of immunity. It can't happen to me, is what they think, and has an impact on health behaviors. Their approach to thinking is logical, organized, and consistent. Many adolescents think in terms of cause and effect. Sometimes they see themselves as exceptional, special, and unique, and they view themselves as beginning to be immune to problems. They tend to be extremely idealistic, and they are egocentric. So you're going to educate them about safety and sex practices and about driving practices, along with no driving with alcohol use. Also in the pre-adolescent stage, it's the post-conventional stage. You teach parents about the questioning of values is normal. The adolescent tends to support the morality of law and order in determining the right and wrong. And adolescents begin to question and discard the status quo and choose different values. So you're going to teach them assertive skills that they can use with communicating with their peers. Moral maturity depends on the context of the situation and the relationship. Again, their own moral reasoning may be overcome by peer pressure. Synthetic conventional stage, curiosity about their religious beliefs is normal, and they question those values and beliefs. And that table kind of goes along with pre-adolescent and adolescent stages. Okay. Let's see. So for the pre-adolescents, you're going to teach about nutrition, activity, rest, those physiological changes, and you're going to promote immunizations again. You're going to teach safety, injury due to sports and play, and then again about healthy lifestyles, substance abuse, and sex education.